All right, we're back for part 4 of the JFK Autopsy report. I've already done parts 1 through 3 if you want to go watch those. I'm Dr. Wolfe, a forensic pathologist medical examiner with a lot of experience in gunshot wounds, and I've been asked to review this autopsy report. We are now on page 4, and this is at archives.gov if you want to follow along. Situated in the posterior scalp, approximately 2.5 centimeters laterally to the right and slightly above the external occipital protuberance is a lacerated wound measuring 15 by 6 millimeters. So the external occipital protuberance is the little bump on the back of our skulls. Some people have a prominent one, like I have a prominent one, but other people do not, and it's kind of smooth back there. But in general, the skull does have a little point in the back. This is to the side of that, and that's when it says laterally. Um, and slightly above. So you can feel that on the back of your head, and it's to the side and a little bit above. 15 by 6 millimeters, or 1.5 by 0.6 cm. All right, so this is a drawing I made. Red in my drawings always represents injuries, and you can see that little external occipital protuberance. I've got a little mark there, and then the 2.5 centimeters, or about an inch to the right of that, is the wound, which is oval shaped. It's about a half to a fourth of an inch if you're more comfortable with that than centimeters. So this defect is consistent with an entrance gunshot wound to the back of the head. All right, back to the report. Clearly visible in the above described large skull defect and exuding from it is lacerated brain tissue, which on close inspection proves to represent the major portion of the right cerebral hemisphere. At this point, it is noted that the falx cerebri is extensively lacerated with disruption of the superior sagittal sinus. Okay, so translating that, the right half of the brain is markedly disrupted. And falx cerebri is basically a portion of the dura, that thick coating of the brain that separates the two hemispheres. Upon reflecting the scalp, multiple complete fracture lines are seen to radiate from both the large defect at the vertex and the smaller wound at the occiput, or the external occipital protuberance. These vary greatly in length and direction, the longest measuring approximately 19 centimeters. These result in the production of numerous fragments which vary in size from a few millimeters to about 10 centimeters in greatest dimension. So, in other words, the gunshot wound enters the back of the head, and at the point of entry, it creates these radiating linear fractures, which also, the reason why there's a large portion of the skull and scalp missing is that when you have a high velocity round, it carries with it a lot of energy, and it actually causes the skull to, in some sense, explode in that area. The complexity of these fractures and the fragments thus produced tax satisfactory verbal description and are better appreciated in photographs and röntgenograms which are prepared. So, in other words, what the pathologist is saying is that there are so many fractures that to describe them verbally would almost be confusing in some ways, and that photographs are the best way to represent these. Röntgenograms is the basically the old name for what we call an X-ray. So if you say a chest X-ray, you're saying a chest röntgenogram. The brain is removed and preserved for further study following formalin fixation. So that is a very typical thing to do when you have a high-profile case, a homicide case. Sometimes you will take the brain out. In particular, one like this, where it was the actual cause of death, and you will place it in formalin, which is a dilute formaldehyde solution that firms up the brain tissue and makes it easier to examine. Received as separate specimens from Dallas, Texas, are three fragments of skull bone, which in aggregate roughly approximate the dimensions of the large defect described above. So, when there are massive head injuries, whether they're gunshot wounds or they're due to motor vehicle trauma or something, there are investigators at the scene, such as police or deputy medical examiners, deputy coroners, that will actually collect biological material and bring it for the medical examiner to look at. It's extremely important in the case of a gunshot wound because we can piece those back together like a puzzle and we can find where the bullet might enter or exit from the skull, which is essential in a case like this. It's also essential that he noted that the fragments, when put together, approximate the size of the hole, because then you know you've got the bulk of the skull fragments. If you had a large portion missing, then there could be an entrance or exit wound in that portion. At one angle of the largest of these fragments is a portion of the perimeter of a roughly circular wound, presumably of exit, which exhibits beveling of the outer aspect of the bone and is estimated to measure approximately 2.5 to 3 centimeters in diameter. So let me explain what that means. Okay, so I made a little drawing to explain what we're seeing here. In other words, there's a fragment of bone, and on the edge of that fragment, there is a circular defect. When we see that in gunshot wound cases, it is going to be either an entrance or an exit point for that bullet. But we know based on the beveling, I use that word beveling. Let me show you what that means. So if you were to turn this bone fragment to the side and you were to see that the outer convexity is where the outside of the skull is going to be. So the beveling part is this part that's kind of chipped away. And you can see I kind of demonstrated it up there as chipped away. And let me show you why that is. This is a schematic that I drew showing on the left there the bullet passing through, meaning it is inside the skull and it is passing out of the skull. When that happens, it will chip pieces of the cortex away, and that's that beveling that they were talking about. Likewise, if the bullet is passing into the skull, the beveling chips will be on the inside concave surface of the skull. And this is what that would look like. I drew this one to show the inside of the skull. So if you are sitting where the brain is and you are looking up at the skull that has a gunshot wound, this is what you would see. This is a fragment of the inside of the skull. You would have the hole where the bullet has passed through, and those chips that are that we call beveling, where the bullet has come in and it causes the cortex to break out into the brain, and it's kind of got this roughened appearance. It's very easy to tell. So when I read his description of these beveling points, it made me feel very good that he actually made good diagnosis. And the forensic pathologists in the past who have reviewed this case agree with his assessment. They might criticize him, but he actually did a good job here, because a lot of pathologists wouldn't necessarily know what that means. Röntgenograms of this fragment reveal minute particles of metal in the bone at this margin. Röntgenograms of the skull reveal multiple minute metallic fragments along a line corresponding with a line joining the above described small occipital wound and the right supraorbital ridge. Okay, so let me break that down. All of these small metal fragments are due to the fragmentation of the bullet. It is a well-known phenomenon that when a rifle round enters the body, it can, especially if it's hit a hard bone, it can disrupt, and it causes what's called a lead snowstorm effect on the x-ray, meaning we look at it and it's just multiple pieces, too many pieces to count, very small pieces of metal, and it's basically the bullet shattering. From the surface of the disrupted right cerebral cortex, two small, irregularly shaped fragments of metal are recovered. These are 7 by 2 millimeters and 3 by 1 millimeters. These are placed in the custody of agents Francis X. O'Neill Jr. and James W. Seibert of the FBI, who executed a receipt therefor, which is attached. And this is very standard procedure. If you find fragments of metal that are large enough to see with the naked eye, you collect those and you give them to the police that are there. That is the chain of custody. And then those can be examined by metallurgists and ballistic experts to match it up with the type of bullet that was used. So in part 5, we will pick up on the bottom of page 4 and continue to talk about these gunshot wounds.